Should I spit out my gum?
So I noticed in a lot of the literature
Yeah.
when I was
I just thought
online
of that.
they just kind of shorten it. They eliminate the orthostatic, even though it's POTS. I did notice in a
Well,
lot
it's
of
what they do is the PO is postural now, and the shortness.
Okay.
So it's still got an O in there.
Okay.
And the orthostatic
Okay.
was a little bit,
Transmit through the microphone.
so they
Okay.
just call it a postural tachycardia syndrome now. But that PO, it comes from the postural.
Okay.
Orthostatics, in some people's minds, suggests because of the blood pressure dropping along with it, and that's not as much a part of this one.
I'll get you guys a white balance when we're just a couple minutes away.
Do you make a video of these or a CD that I could get to send to my
Yes.
kids?
And what we'll do, this will be available online, the full version. It'll be available online, so I'll make sure I email you the link.
Okay.
And I'll email you the
You
link.
can cut out the
And then
gaps.
afterwards, just after this ends, we edit a shorter version that goes onto the OU Medicine YouTube channel. And we can certainly get you a copy of that as well
Okay.
for posterity. So you'll have that as well.
So are people allowed to call it, like to call and ask questions about this? You know, I had a lady get in touch with me through a friend of a friend of a friend after her article ran, and she's been sick all of this time and was asking me about it. Do people have a way to call in, or is that not
Well,
allowed?
as I had mentioned, we've already had 10 people call, or one called and another email. What we're hoping to do is that for those who have a serious desire to get in some type of an evaluation for it, I'm trying to set up a couple of my colleagues that are in already the cardiology, but they're so busy with the kind that end up with catheters and all these things that we don't. I'm putting together this little thing to give them but I don't want to get into phone conversations. The one guy that called today, I don't know how he got my number. I think he got it off the website or something. And I have to be careful. And 15 minutes later, I said, "Lee, I've got to go." I mean, he had reasonable questions. He wasn't obnoxious. It's just that
This lets the camera set their
who are these
colors.
people from?
You've got channel 4 and 25 here. And 5 is watching online. Tulsa usually watches online. And 9 was a maybe. So I sent Amanda's going back upstairs to wait just in case they come in late. We'll bring them in. Everyone good? Okay. We'll do a little bit of housekeeping. Anyone who has a phone, if you could just make sure that you've silenced it or turned it to vibrate, that would be, I'm usually the biggest offender, but that would be great.
Will you make sure mine is, it's in my purse?
April, did you get a press release?
I need a phone book to sit on.
You gotta. How tall are you?
I think I'm 5'7", 5'6".
5'7".
I always say 5'7".
But your
You sit tall.
torso is longer and
She sits
legs are
very
shorter,
tall.
so.
You know, that's one thing in news that they always said is that even though the men are taller, that usually the women and the men sit because women are usually taller or almost equal.
Yeah.
The trunk's longer and the legs are a little bit shorter.
Right.
And so,
So we sit taller. Which is good.
of course, my wife walks faster than I do too, but
Although anyone who sits next to Kevin Ogle looks short. Okay. Well, we're going to get started. Are we streaming, Josh, and you're good for audio? Okay. I'm going to start with some basic introductions. Want to thank you for being here today. And we're very excited. We're announcing results of research that has to deal with a tachycardia, a syndrome. It's postural tachycardia syndrome. Say that 3 times fast. POTS for short. And with us today, I have Dr. David Kim. He is an OU medicine researcher, also a physician. So he's going to talk a little bit about the condition, what happens with the condition, and then a little bit about their research and what they've discovered. And it's very exciting because they've discovered our own body's immune response plays a role in this tachycardia. And then also joining me is J.C. Robison, and that's Jaycirobison. And she has POTS, so she's going to talk a little bit about how this has impacted her. She is a basketball player. And one of the interesting things about this condition, and Dr. Kim's going to talk about this, is for people who have it, just the simple act of standing up can cause their heart to race. And so something as simple as just changing your posture can impact your heart rate. They're going to talk a little bit about that. Mom and Dad are also here. They're off in the wing, so if any of the reporters have questions for Mom and Dad, we'll bring them up to the microphone and have them answer some questions as well. So we're going to start with Dr. Kim, and I'll let you take it away and talk about the condition.
Thank you, Teresa. It's a pleasure to be here. I just wanted to first introduce also some people important in the work that has taken place. Dr. Yu is a partner of mine for the last 16 years and has taken a major part in this and the whole development of this area. Dr. Lee has been a person who is the first author on this study and has done a lot of the work himself, and very appreciative. And Ms. Benbrook, who has been the person that has made the laboratory go, are here. And then there are a number of others who couldn't be here, including a grandson from OSU that have worked on this. So I want to thank them. And I also want to thank very much the Heart Rhythm Institute, where we do our research and are surrounded by cardiologists. And in fact, the cardiologist that referred JC to us and some of our patients. One of the advantages of working there is that they're involved in tachyarrhythmias, that is rapid heart rates of various types, and this is one of them. And they asked me, an endocrinologist who works in that area, because I'm interested in hormones that affect the cardiovascular system. And in the last 8 to 10 years, we've been interested in antibodies that are hormone wannabes, and they act like hormones also. And they asked me if this patient might have a pheochromocytoma, which is a tumor of the adrenal and causes the rapid heart rate and high blood pressure. And after looking at the data that they obtained and my suggestions on these patients, they said no. And so we started looking at them from a different perspective. And we were able to postulate, or that is predict, that these patients, instead of having a tumor releasing the hormone norepinephrine, might have an antibody that was acting in the same way, but that it was acting in a different fashion, and not only did it stimulate, but it also blocked at the same time the norepinephrine in the body. And this would fit with the diagnosis and the findings that we find in POTS. And for this reason, we then, for the last 2 years, have been looking, 3 years almost, laboriously trying to dissect this out. And we've been fortunate to be able to discover that not only was there an antibody that was mimicking this hormone norepinephrine in the body, but there is another antibody mimicking the norepinephrine effects on the heart rather than on the vessels. And both of these antibodies together, we think, are the explanation for the POTS. And I have a diagram that would show this. I'm not going to show it right now. We can talk about it later, that illustrates it. But this is very important because no one has known the etiology in the past for this condition. And now that we feel that we've identified it, and the group from Vanderbilt has been very helpful in sending us patients that we didn't know their diagnosis for sure. We measured them, and then they confirmed with us which they had, a control or that. And in effect, they helped confirm this diagnosis with us. And we have a very close relationship, an appreciative relationship with them. We also have a relationship with the University of Missouri. And the person who helped us to develop the test, Dr. Mike Hill up there, for this test. I can't forget at all the fact that the VA hospital has given a very generous grant for our support for this. And I'm very appreciative for the VA and the American Heart, and also for some individuals who have contributed that prefer their name not be given at this point for this support. And so with that, I just wanted to make a very brief statement of thanks, because we're blessed to have this type of support.
Dr. Kim, could you explain, before we put JC have her talk, could you just talk a little bit about antibodies? That's a natural part of our body's immune response, correct?
That is,
talk a little bit about what they do.
that is correct. An antibody is what permits us to get along in a very unfriendly environment. And we were provided with this means of developing an attack. And the best example is when a person would be exposed to a virus like polio virus. And now that we're all in this country immunized to it, the virus may get into our system if it did, and the antibodies would rise to the occasion and eliminate it before it could attack. And so that's a protective. There's a second thing that happens with antibodies, and that is sometimes they get out of control. And the best example is certain types of thyroid disease where an antibody is against the thyroid and damages it. And about half the patients with low thyroid have this, we think, as the cause. But 50 years ago plus, they discovered that antibodies could also stimulate the thyroid. And people who have an overactive thyroid, the most common type, is caused by an antibody which grabs a hold of what we call a receptor. That's a protein on the surface of the thyroid tissue. And this receptor is activated. It's like having a cell phone, 2 or 3 cell phones on the surface. And if one of them rings, what happens? You answer it, don't you? Something happens. Well, this is the same thing that happens with thyroid. When that receptor is activated, the thyroid turns on. The same thing is true in the heart. There are receptors that are turned on in the heart and in the blood vessels. And so when that cell phone rings, it acts and constricts, or the heart goes faster. Along comes an antibody, and it acts on that receptor. It doesn't turn itself off like the other hormones do. They'll act for a moment, and then they get enough. An antibody is very persistent. It sticks there and stimulates and stimulates and stimulates. They become overactive in thyroid. In the case of what we now think in this situation, an antibody comes along after an illness. JC's going to tell you a little bit about that, but she had an illness that is known to have antibodies respond to it. We don't have proof in her, but we suspect strongly because of the history that these people that have mononucleosis, but other viruses too, and perhaps bacteria, will have antibodies that develop for some reason. And there's another group of people we're interested in who have heart attacks, and they release protein from their heart. And this causes antibodies that Dr. Cunningham, who's one of our partners, has already shown, and as well as others, causes hormones to act, these antibodies to act like hormones. Well, that, I hope, is a long answer to a short question.
But essentially what's happening is these antibodies are overstimulating and keeping that signal going.
They keep on. They don't let up. And so it's our desire to find, and we have research in progress, to block these antibodies. But this is not in a position yet to release this, but we're working very diligently on this, and we think that very promising avenues are ahead of us.
JC, talk to us a little bit about, I know you're an athlete, you play basketball, and dreamed of playing college ball, but just talk to us a little bit about what happened? How did you know something wasn't right?
Well, I don't know. I was just playing basketball one day. I think it was not last summer, but the summer before. And I remember just getting really hot and overheated, and I passed out in the middle of the game. And we thought it was just dehydration, and so we kind of just brushed it off. And then it just started to happen every day, and then 3 to 4 times a day. And then instead of just passing out, I would get chest pains, and I couldn't breathe, and I would get nauseous and get headaches. And as more symptoms came along, I kind of started to think that something was wrong. And I was actually driving one day and I passed out at the wheel. And after that was really scary. So we actually went to the emergency room. They told me nothing was wrong because all my tests looked fine. So after that, though, we kind of started to pursue a diagnosis, and we went to doctor after doctor after doctor. And we actually went to the emergency room again. They told me I had anxiety, and I don't know, I could just tell that something else was wrong. I wasn't just anxious. I mean, I was, because I thought maybe I was dying because no one knew what was wrong with me, and that was scary. But I knew that it was more than anxiety, so it was really comforting to finally get a diagnosis.
And you said it's really changed everything that you do. Like, you're careful about how you stand up. Talk about the things you've had to do with people around you just to make them aware.
It's a complete and total lifestyle change. I mean, you don't realize how good you have it until it's gone. But I mean, I took so many things for granted, and I don't really remember what it feels like to wake up and feel good. I mean, I don't remember what that's like, but you just have to roll out of bed and keep going. And I mean, I don't go anywhere without a Sprite and a beta blocker because you don't know when a symptom's going to hit. And it's been challenging to make people aware, because when you do pass out or you do get a chest pain, then people are going to think you're dying and they're going to want to call 911. So it's been challenging to keep everyone calm and just put them at ease that it's not a life-threatening condition, and I'm going to be okay. So
does it eventually reset by itself? Like, when you have one of these attacks, and I know you still get them fairly frequently despite treatments, does it just go away, or do you have to take the medicine to stop it?
It usually goes away. I just have those on hand just in case. If I can feel it coming on, then I'll take medicine beforehand. If I can't, then I'll just let it happen, and it'll fade over time. But it's a day-by-day thing. You don't know, some episodes, I call them, might last 10 minutes, some might last an hour. You just never know.
Most people pop up and out of bed or out of a chair, up and ready to go. You're not able to do that.
No. If I did that, I'd be on the ground really fast. But no, and that's you just have to be cautious of everything. I mean, even when I do exercise, I don't really feel good exercising at all, but I have to be aware of overexerting myself because, they say exercise does help, and it does. It makes you sleep better, but at the same time, you have to be careful not to do too much because that's going to hinder your progress too. So.
What do people around you think of all of this?
I get a lot of strange looks. Last year before I was diagnosed, I got a lot of strange looks because I would just pass out in the hallway and no one knew what was wrong. Now we live in a small town, so a lot more people know about it, and so that's been easy. But, I mean, you pass out in a basketball game, people are looking at you like, why are you playing basketball? That's not fun. But I'm not doing it for me. I'm doing it for my teammates. And it's cool to tell people I'm doing this because God's giving me strength. I mean, that's good too. So it's been a good platform.
Dr. Kim, can you talk a little bit, how many people are affected by this? I mean, who does it affect? I know it's mostly young women, correct?
Well, that's correct. The ratio is about 8 to 1 or 8 to 2 or something out of 10. Young women particularly, but we also find older women and men with this. It's estimated that up to 500,000 people in just the U.S. alone have this. Now, this can be transient. That is, it may last 2 or 3 years and tend to get better. We've had some patients who's lasted a long time and older, and so we have no way of predicting that pathway. And so these are estimates because it's not a life-threatening, although it could be if you're driving and you're like this. But the issue is that this is one of the things that if you have a condition that doesn't kill people or do something severe, then it doesn't get the support for research that, like the old adage, millions for certain conditions, but nothing for the common cold. Well, now we're getting more into the common cold, but nevertheless, infections have been noted to be frequent in people. But in our study, for example, we had only about 2 of our patients, or 3, that could recall having an infection in the history like JC had. Others don't, and some of our controls had infections. Now, they obviously might have been different infections, and it didn't do that. So it's just not as clear-cut. But autoimmunity can come from a variety of things. And sometimes these viral infections are something you may just feel you had a couple days, you're feeling a little bit lower or something without being sneezing and coughing and put to bed or something like that.
The targets you've identified, there are 2 antibodies, correct? That you've identified?
Well, there are actually 3 that we've looked at. But the 2 main ones, we call them, they're called alpha and beta 1 on this, appear to be, they were in all of the patients, 14 that we studied. The beta 2 is an interesting first cousin of the beta 1, and it was in half of them. And it was important for our study because it interfered with one of our tests. But it also may also contribute. But we have to study more patients to find out, because the beta 2 can cause the blood pressure to drop some. And one of the problems that in trying to differentiate, in fact, I was wanting to ask JC that, because if you have a drop in blood pressure that's pretty significant, then it's harder to say this is POTS. It may be orthostatic hypotension, another entity. And then increase in heart rate is a normal response to your blood pressure dropping. And this is why the physician wants to check it out and have you all the time, what was your blood pressure response during this time, and also what did your pulse do? POTS classically is defined as a rise in heart rate of 30. Did you find your heart rate usually fast when these episodes were occurring?
Yes.
I thought you did. But anyway, the second is that their blood pressure usually doesn't drop more than 5 to 10 millimeters of mercury, in contrast to 20/10 or more for people who have diabetes or other neurologic conditions. And this is to be separated from these other conditions. Now, I also can't say that you couldn't have 2 conditions overlapping with each other. But when she fainted, for example, that's not as usual in POTS. But most of the time, as she was telling me right before we started here, she's exercising pretty vigorously. And most people with POTS don't push themselves like a young 18-year-old playing basketball. And they know enough not to do anything like that. And you're healthy enough that you could handle that. But I think that I just want to make that point for people listening, that if their blood pressures are dropping more than that 10/5 millimeters, then they may have something else that needs to be differentiated, and their physician can help differentiate on that.
It is the rapid heart rate that is...
The rapid heart rate, and also the association of this norepinephrine in their body trying to compensate for the little drop in blood pressure that occurs when that alpha blockade occurs. And so they get a norepinephrine rush, if you will. And to some people, that's okay. But when you get it like you do, that's not very pleasant at all.
And that's what causes the chest pain.
It causes the heart rate to go too fast. You're not putting as much blood in the heart, and it can cause a compression. The chest pain may or may not be from the heart itself, but it's a part of occasionally seen on that.
JC, talk a little bit. There are other symptoms, because you mentioned the passing out, which is a little more unusual with POTS, but you said your finger, do you feel it kind of coming on, your fingers, your hands?
Usually I can feel it coming on. I get kind of shaky, my hands kind of tremor, and I can just feel it, kind of gradually speeding up, and so I'll just
That's the
sit
norepinephrine
down.
rush.
Yeah.
And people that have diabetes and take insulin and get low sugars, when they get their sugars real low, their epinephrine comes out, and they get many of the same symptoms. Their heart rate goes up, they're sweaty and tingly, and don't think as clearly. And then they don't usually try to play basketball or do something vigorous, and that's where we get her off to a little bit to the side.
Okay. Mom and Dad are here, and I know I've had request, and I'm really gonna leave it up to you, but Dad, do you wanna talk a little bit about what it was like? I need you to go up to the microphone next to JC, and I can take that chair there, but just to talk a little bit about what it's like for a parent to have experienced that.
JC, just out of curiosity, what happened when you passed out drinking? You just kind of,
You want to speak into,
Well, I don't really know because I passed out, but
did you just roll on the side of the?
someone was in the car with me,
Okay.
so they took the wheel, but I had no idea it was coming on at all, so I don't know. It was-
Curious.
yes.
Scary. Okay, then we'll move the microphone to Dad. And would you say and spell your name just for everyone?
Sure, Jason Robison, JASON,
So Jason, what was this, yes, what was this like for, as a parent, you know, you take her to the emergency room, they don't find anything wrong, but you kind of know something's going on, right?
I think we did. I think my biggest concern, as well as Tori's, was just her overall health, and finding the diagnosis was probably the most stressful. Going through a process, Tori had gone through 4 or 5 surgeries, so we had already been through the process of finding it hard to get a diagnosis with her, and then JC's situation came along, and she actually got dizzy. I was making her do yard work. And she started kind of getting spotty vision and kind of felt like she was going to pass out. And, of course, I was like, just go inside, get a drink. And Tori she's all right. She needs to get tough and get out here and do leaves. So I think that was challenging, not only finding the diagnosis, but then at that point is finding how hard we needed to push our kid. Because our expectations are high as parents for our kids. And so at that point, once she was diagnosed, that stress was over, but then the new stress was how hard do we challenge our kid, because JC really has never been, she'd never needed pushing. She'd always been very much an overachiever. And now that she was diagnosed with POTS, I had just almost given up on the fact that she needed to be pushed athletically. I didn't want her to play basketball. It wasn't worth it. I couldn't do that. I'm too selfish to put myself out there if I couldn't perform at a level that I wanted to compete at as an ex-athlete myself. She chose to do that. And so selfishly, I didn't want to see her go through that. And she chose to do that. And obviously she prayed about it, and it was prayerful, and she used her own discernment and did that for community of Cashin, her teammates, her family, whatever. Selfishly now, still to this day, she's using this as a platform. As a dad, I'm having a hard time, I think. I just want her to get better. And this is unbelievable, and I thank you, Teresa, Dr. Kim, everybody for doing this. But selfishly, as her dad, I'm hoping this not only is a platform for her, I just want her to get better. I want a remedy.
I know this is exciting news because Dr. Kim and fellow researchers believe this may be a first step toward a treatment, potentially a way to stop these attacks. What would that mean to you as a dad to know she doesn't have to go through this anymore?
It would be a huge blessing. And I told Dr. Kim when we met the first time she had her infusion how impressed I was with him and how we would do anything we need to do, not only to help with remedying POTS, but also for our own kid. We would do anything we needed to do to have progress moving forward.
What are her treatments like right now? Because I know she does have infusions and other things to try to control. Can you talk a little bit about what she goes through?
Yeah, I mean, she, in the beginning, and her and Tori could probably be much more detailed than me, but in the beginning she was taking around 17 pills a day. That was hard. I mean, for anybody, I think. And now we've reduced that to maybe 8 to 10. Is that about right? So that's better. And Dr. Shaw he's been a blessing as well. I mean, as far as trying to limit, I know some of this is exploratory, trying to limit some of the medications that she's taking. Dr. Lockwood, I think, has also been good. But I think the infusion, the first infusion was about 8 or 12 hours. And she responded pretty well, and without jinxing this, I mean, I think she responded pretty well to that. The last one, I think we maybe did a little too quick. It was a double dosage, and it was about 6 hours, and she had a pretty bad headache for a couple of days. But today she's got color in her face. She's she's smiling, she's more like herself, and so I think maybe that's having some impact, positive impact, and that's a blessing as well.
And I'm going to pass the microphone to JC. JC, at this point, there is no cure. And some people do kind of outgrow it, or it ceases at some point. What would it mean to you to know that there's a treatment, a cure?
It would be amazing. I mean, getting a diagnosis was really the hard part because it's a relief, and the not knowing was scary. But once you're diagnosed, it's kind of like, okay, what next? It's cool to feel like you're moving forward and you're not just stuck in the same spot with no solutions. And not just for me, but I've connected with a lot of people with POTS, and it would just be cool to know that those people could get relief too, and that they wouldn't have to be unhappy and miserable every day. So it would be awesome.
Other questions?
Could I comment on that?
Yes, please.
I hope that we can call another news conference in a year and announce that we have published a mechanism for curing that. We're on the way in that regard, and I'm not in a position to talk about it now, but I'm optimistic that we're making progress. And while availability for a human would be even after that, because it takes a long time, we think that things are on the way.
Could you also talk about, this was a tremendous collaboration, correct? Because I know you needed help from Vanderbilt in particular to get enough patients for you to study this and be sure that what you were identifying was what you were identifying, correct?
Well, that is correct. There are actually a large number of patients available, but theirs are very well characterized, and they were in a position to send them without our knowing exactly which ones were not. They were outside. And this becomes an important part of the scientific process, that when we present something, then somebody else has to confirm it or deny it, as occasionally happens. And in a way, we tried to combine that into one publication, because we, in effect, had our first phase, we made our observations, and then we had theirs come in with patients that were independent of ours and wouldn't be prejudiced by our thinking that they did this or that. So it made for a very nice arrangement. So we think it's 1.5 ways, but we'll still have to have other people, and we're planning to expand these studies. Dr. Yu has just turned in a grant application to the NIH for a 4-year study on this with Vanderbilt as co-partners, and are working on this area.
With that, I think we'll close it out if there aren't any other questions. Pretty much covered it. Okay. Great. Thank you, everyone.
Thank you.
Thank you, JC.
Thank you. I'm
Let me
excited.
ask you a few more questions.
Okay.
Now, when you were sitting